Hi, I'm Dr. Kelly Starrett with H-Wave. One of the reasons we love using H-Wave early in the mobilization process and the healing process is that it solves a couple problems for us. Oftentimes, long-term immobilization, lots of swelling, and even pain can lead to sort of decreased neuromuscular connection. That oftentimes that swelling, that pain inhibition makes it difficult for me to sort of recruit the system back on. And what a clever design by the brain to say, hey, we've got pain here, let's go ahead and sort of inhibit a lot of the movement in the system. The problem is it's difficult to heal, it's difficult to maximize sort of retention of musculature if we're not engaged in early movement. So with use, judicious use, cautious use, or aggressive use, one of the things that we see around H-wave interventions is that we, number one, are able to maintain a much better brain-body connection. That constant muscle contraction gives me a couple things. One, I'm seeing less pain inhibition because the movement of the tissues. I'm not moving my arm for the first time or moving my leg for the first time. Second is that because I'm having less congestion, oftentimes that can have less pain. But because the contraction is there, even just the proprioceptive feedback of feeling the tissues move, keeping that muscle kind of tied into the brain, oftentimes we see much better early mobilization, early movement strategies, and we don't have to do as much sort of waking or reawakening the body's systems. The second thing that's worth mentioning is that after surgery, especially in our high athletic populations, we do see a potential for loss of musculature. That we see muscle mass changes, and oftentimes it's difficult to actually reclaim calf sizes, for example. If I have a certain muscle size on one side, after a surgery, I may be losing some of that calf musculature. We see the same thing in the quads. And what often happens is if we can just get that quadriceps tied back into the brain with early movement, then the brain doesn't start kicking out structural proteins as early. That means that from an aesthetics or even function, we are interested in function, but aesthetics do matter. We see that early mobilization and reconnection of muscle contraction, even if I'm immobilized, getting movement without motion can help me with neuromuscular connection and help maintain my native musculature that I had going into the surgery. So again, oftentimes we fail to think about some of the downstream effects of movement on the health and recovery after a surgery or trauma, besides just congestion and advanced healing.